My one big takeaway for other families would be to trust your instincts as a parent and knowing that you know your child best. Even though you'll be getting a lot of different medical advice coming at you, it's really important to remember that as great as doctors are, that they don't know everything and every child is different, and one particular solution for one child might not be right for your own child.
I think one thing that can be hard, and I don't know if it's just a mom thing or just me, but as we were with other parents, what was right for one kid with the very same diagnosis might not be right for the other kid with the very same diagnosis. And that took a while, I think, for me to figure that out, that because they're doing this therapy or doing this approach or whatever, doesn't mean that I'm not doing the right parenting because my child doesn't have that, or we're doing something different.
One thing I learned that took me a little while to learn, but it became the most important thing for us in our journey, and that is that it all takes time. That we couldn't figure out at the beginning where we would be a couple of years later. And so it was really important to just let time take its course. And I had to step back sometimes and say, well, I don't have to know everything today because Katie's going to grow and she's going to look different in a year. And that's exactly what happened. So as the years went by, now looking back, I realized that time was the most important factor and that we couldn't solve everything all at one time. And I also now know we aren't going to solve really anything. We are going to figure out the best way to manage and the best way to make Katie's life independent.
The other suggestion I have is just to realize that it is going to be overwhelming, and just be patient with yourself and not think that you're going to learn it all in a day, but know that it gets better with time.
My one pearl of wisdom for another family would be to take it one day at a time. It's important to know the big picture, but you have to get through each day, and it can be overwhelming. So if you look at what you've got to do today and what you've got to do tomorrow, it will help you get through the rest of it.
I'd say the most important thing I've learned is not to be afraid to ask questions, and also not be afraid to ask the word why. Your daughter needs these braces. Why? What are they going to do for her? And asking if that's the best option. You know, there were a few options besides the rhizotomy, and we actually had a team of doctors come in and discuss them with us, and asking those questions I think was really important. And not being afraid to go to more than one doctor to get an opinion if you feel like you need that.
Being that my child has multiple disabilities, my big take would be only concentrate on one at a time. Find out what is the most important and most pressing disability that affects the day-to-day life, and concentrate on getting to know the most about that. And then when you've conquered that subject, you can go on to study the other ones, but find out the one that's most important, that's going to affect the day-to-day, daily living.
I would tell other family members to not give up, to just keep on asking questions. It's what I've done for all of Wyatt's care. It's a great tool to have.